Ah, ACL tears, the bane of every runner, athlete, gym-goer, and movement enthusiast's existence. ACL tears are among the most frustrating knee injuries and have long been seen by athletes as a one-way ticket to surgery. But new research suggests that if you're patient, disciplined, and trained smart, recovery without surgery might be within reach. How? Let's dive in. So what the heck is the ACL anyway? The anterior cruciate ligament, the ACL, helps stabilize your knee and prevents the tibia, your shin bone, from slipping in front of the femur, your thigh bone. Quick changes in direction, sudden stops, or direct hits, especially in sports like soccer, basketball, skiing, or football, can tear or snap the ligament. Historically, doctors believed a torn ACL could not heal on its own, so they recommended surgery. But even as far back as 1996, we've known that fully ruptured ACLs can heal on their own. So why then do doctors and surgeons keep recommending ACL surgery? Well, one big reason is ACL repair surgery is a big business, generating around $7 billion annually. But recent research challenges this big business surgery money-making machine. A study published in the British Journal of Sports Medicine in June found that 90% of ACL tears in 80 participants showed signs of healing on MRI after following a new bracing protocol. Most of these patients were able to return to their sport a year later with good knee stability and function. Participants in this study wore a brace for a month that kept their knees at a 90-degree angle, pulling the torn ends of the ACL closer together to help them fuse. Stephanie Philbay, lead author of the study and senior research associate at the University of Melbourne, said this position increases the chances of healing. Along with the bracing protocol, over the next 2 months, the patients in this study also did physical therapy while gradually increasing their range of motion with the brace. After 3 months, the brace was removed and MRIs showed most ACLs repaired themselves. We have now braced over 430 patients in clinical practice with similar high rates of ACL healing and excellent patient outcomes, Philbay said. But what about other expert opinions? What do other doctors and surgeons think? Dr. Lyle Michelli, an orthopedic surgeon at Boston Children's Hospital and Harvard Medical School, said, "This study could be a game changer." But what about people who've actually lived through both surgery and physical therapy for ACLs? Dr. Mariam Sadie, a 40-year-old surgeon with Kaiser Permanente, wasn't given a non-surgical option when she tore her ACL in 2008. She ended up with scar tissue, arthritis, and a limp. A decade later, she tore the same ACL again, but tried physical therapy instead. 3 months later, she was back on the basketball court, hooping it up. How did this surgeon feel about her non-surgical choice? "I'm perfectly happy with my knee," she said. Now let me share a personal story, because I've had my fair share of knee injuries too. Since I've been an athlete my whole life and done a lot of running, jumping, and lifting weights, I've had more than my fair share of knee pain. First, there was the runner's knee and jumper's knee, but the real kicker came in when I almost severed my knee in half after a nasty fall. The pain was excruciating, and I was left wondering if I'd ever be able to train or compete again. I thought I might need surgery, but I knew there was another way since I'd already overcome my hip impingement and labral tears without surgery. So I turned to smart strength training and mindful mobility. Here's what worked for me: smart strength training. I focused on exercises that strengthened my quadriceps, hamstrings, and glutes without putting too much strain on my knees. Mindful mobility work. I incorporated targeted tissue work, stretches that didn't strain my knee, and controlled movements that helped me regain flexibility and prevent stiffness. Over time, I noticed significant improvements in knee stability and reduced pain. With patience, persistence, and discipline, I was back on my feet faster than anyone expected. So what are the long-term risks and benefits of surgery versus no surgery? Well, in the past, research showed that 50% of patients who have a surgery still develop arthritis within 12 to 14 years. Not great, but supposedly without surgery, the chance of getting arthritis was worse. But new research has shown that there is no difference in the rates of knee arthritis in people who do or don't have ACL surgery. So what's the takeaway here? If you're dealing with an ACL tear, there's no rush to get surgery. First, talk with your doctor about all the options: surgery, bracing, physical therapy, and decide what works best for you. Because ultimately, discipline, patience, and smart training might just help you overcome this challenge without going under the knife. If you're struggling with knee pain of any kind, from runner's knee, jumper's knee, or any other knee issue, we've got a 45-day knee pain program designed to help you recover and get back on your feet. It's a holistic approach focusing on strength, mobility, and proper technique. And for those who want a more personalized approach, our VIP mentorship program offers one-on-one coaching to guide you through your recovery journey. So if you're ready to take charge of your knee health, let's get started together. I hope this video was helpful. If so, please like, subscribe, and share with anyone who needs to know that there is hope for knee pain beyond surgery. And as always, please remember, you're just one step away from building or rebuilding your perfect body.